A lot of people think that I'm wrong, and I think that's awesome. I'm an ER physician, and I think that we need to completely overhaul our health system. Here are a few of the comments that I've received on videos on TikTok and YouTube. A lot of bad ideas squeezed into your short video. Sit down, your privilege is showing. The results of your philosophies are so consistently awful. You have really awful ideas. Your ideas would just make it worse. This is really dumb. Your views are thankfully going nowhere. A bunch of nonsense. I would never, ever go to a doctor that thinks the way you do. You and your ilk are extremely dangerous. Now, you may have received comments like this as you've strived to improve health or strengthen our health system. The idea that ideas are awful or wrong is dangerous, because when we're trying to transform the health system, the most important thing is that we stay consistently focused on what we as a society want the most. And I argue that's optimal health and well-being for all at the lowest possible cost to the system. And that will result in a number of ideas that don't work out. So just like when an entrepreneur comes up with a number of business ideas, some don't work, some do. And so the key, I believe, is to stay focused on what we really want. And so if we don't change, then we are choosing the status quo. Let me say that again. If we don't change, we are consistently choosing the status quo. Now, I'm energized and motivated by ideas that were viewed as wrong in the past, but turned out to have a lot of good with them. So, for example, in the 1840s and 50s, hand washing was viewed as a wrong idea. Alternatives to mainstream medicine, so mainstream medicine was bloodletting and mercury, were viewed as wrong. In the 1890s, hospitals were viewed as wrong. Medical specialties were viewed as wrong. Women as physicians, blacks as physicians were viewed as wrong. And germ theory was viewed as wrong. So I think there's a number of reasons why we might, as human beings, respond reflexively to an idea and say that it's wrong or that it's dumb. One is if we're invested in the status quo. Many of us are invested. I'm invested as an emergency physician. I'm invested in the way things are. I'm invested financially. My comfort level is invested in the way things are. So we might feel a repulsion to any idea about change because we're invested in the way things are. There's also an idea of cognitive dissonance that I'm learning about. So the idea that when we learn something and be committed to it, there is a feeling, even a physical sensation that wants to go against any new idea simply because we have chosen and heard that idea first and been committed to that financially or emotionally or intellectually. I think the third idea is that certainly some of the ideas that I've set forth could in fact be wrong. And I'm not disputing that at all. And whoever gives these comments could be right, but we need to find a way to communicate in a way that we can challenge each other's assumptions and ideas and come up with something that works better than the status quo. So my intent isn't necessarily to advance any specific ideas, but I'd like to contribute to or catalyze a shift in the conversation, a shift away from simply patchwork or additions to the current paradigm, which is dominated, I would say, by rescue treatments, by elitism, and by financial profits, to a paradigm or phase or structure or system that's dominated by health and well-being for all at the lowest possible cost for the system. So I have advocated for getting rid of fee-for-service completely. for basing the pay and incentives of health workers and faculty at universities and public health workers and those in politics. Their pay should at least partially be due to the health and well-being of their population, along with equity and the efficiency of that. So are we advancing health and well-being at the lowest possible cost? I've also advocated for mandatory pre-health or mandatory pre-medical majors in health systems transformation. And then finally, I've advocated for the progression of health professionals towards diplomas, licensing, and board certification to be more personalized and adaptive so that we eventually do away with residency programs. Now, all of those ideas might be wrong. They might be proven out to not work, and I'm perfectly fine with that. What I'm trying to do is, in a reasonable and rational way, think, okay, the current status quo is unacceptable. If our goal is health and well-being for all at the lowest possible cost, then how can we get there? So the idea that I'd like to advance is that through conversation, we can then act, we can then try different things. Many, maybe even most of those ideas will fail, and then we'll find something that works, and eventually we'll reach a tipping point where there will be a shift in the paradigm, and we'll be in a better place than we are today. I'd love your thoughts.